All right, Paula, here we are. Welcome to the show. It's a beautiful day here, and we're not going to have any small talk today. We're just going to get down to the nuts and bolts, learn a little bit about you and your investing path so far, so that way we can share your experience with the listeners out there. So, first of all, welcome. Tell the listeners just a little bit about who Paula is, where you're at in your medical career right now.
Yeah, so I am a professor of medical education for the University of Virginia, and I'm the System Chief of Trauma and Acute Care Surgery for Inova Health. I came to the United States. I am from Colombia originally. Came to the United States and did internship at the University of Miami. Then I went to the 𝗘𝗽𝗶𝘀𝗁 in Boston and finished surgical residency. Then I went to University of Pittsburgh to do a fellowship in surgical critical care. Then I went to shock trauma and became their first acute care surgery fellow. And I was at Virginia Commonwealth University of DCU for 11 years, and where I directed the unit, was part of the board, and did a couple of other things, and became professor of surgery. And then I joined Inova in this leadership role 3 years ago, and we keep growing strong, mentoring and helping and developing trauma systems.
Wow. So, Inova, and that's in the Richmond area, is that
Yeah.
correct?
Inova is a five-hospital healthcare system in Northern Virginia. We
Northern
serve a
Virginia.
population of 3.2 million people. The emergency room of Inova Fairfax, which is our main hospital for the campus, is the third busiest emergency medicine emergency room of the country. We
Wow.
have a blood bank that we own, which is like the second largest in the country, and we also have it's a five hospital system with
Wow.
three hospitals that are trauma centers.
Wow. So thank you as a user of those trauma systems. Unfortunately, it is means so much to us to have you to have that professional to calm down, assess the situations, and keep everybody as safe as possible, as healthy as possible. So thank you for what you do, controlling the chaos in those scenarios.
Thank you.
All right, so talking about chaos, let's talk a little bit about investing chaos. Where are you? So you've got so much going on, a trauma surgeon, a professor, all of this stuff, a massive trauma unit. Where do you find time to invest or learn about investing?
Well, so I think for all physicians, especially surgeons out there, and especially women physicians, like I believe that nobody teaches you that when you're in medical school. Nobody teaches you that in residency, and we keep and some of us, because of the way that the careers, we go into like large amount of debt to be able to become physicians, and then we spend a lot of time paying their debt, and you keep delaying, right? So you're not gonna save now because you're a resident and you're poor, and then you don't save at the beginning as an attending. But if you don't start thinking about investing and creating wealth for yourself when you retire, but also for your family, that you're gonna start a little bit later than anybody else, and that has to be a priority for the women physicians out there. I think that that needs to be very top of your list when you graduate from residency. Don't wait. I mean, it's important that you discuss that with your partner, but don't wait to have a partner, or don't wait to have those investments, because as we know, the more time passes, the less chances that you have of creating that equity. So I am extremely lucky because I didn't have that debt, right? But I know I had classmates in residency that have like ridiculous amount of debt, like $100,000 debt. I didn't have that, and that's a good thing. But I think that opportunities to in residency, moonlighting, and actually living with the minimal, so you can start paying that debt fast, and then as soon as you can get a house. I know sometimes you're like 2 years here, 3 years here, but once you have your real job, your first real job after residency, that will be the perfect time for you to start investing in owning something.
Hmm.
Even if afterwards you are going to have to sell it if you have to move, but that amount of time is critical. I think that you from your number one when you graduate from residency to your number 10, that time is critical.
Yeah, yeah. And it's again starting to build that foundation. But there's also a challenge too of information overload on what to invest in. But what I'm hearing you say, Paula, is just making something as simple as your own house, your investment.
I think that this is also important, and I don't want to make this all about gender, but I think it is this part is important about gender. From female physicians, when you're negotiating your contract, you in some occasions female physicians get paid less than male physicians. And you might think it's nothing because it's like what, $10,000, $20,000, but over the years, in 10 years, there's going to be a lot of money. So I think from starting to know your worth, investing smaller things that are going to give you a larger gain. Invest in having a financial advisor. Invest in having a lawyer looking at your contract so you're actually getting paid a fair market value. Invest in taking the time to set aside money and think about the trajectory of your life, right? Instead of we get too caught in the 80-hour work week and going into the hamster wheel. You have to actually pause and take the time to think about how do you want your future to look like.
So making sure that you're getting paid not only the market value but what you're worth. I think that's remarkable.
I think for all physicians in general, but specifically for surgeons, is time, right? So because your day starts. Your days, like most people, they start at 9 a.m. and finishes at 5. Our day starts at 6:30 and finishes whenever. And we work nights and we work weekends. So number one is time. Number two is, I think we're a little bit risk adverse, and I think that's every human. But when
physicians across the board for the most part too.
Yeah, so when I describe, like, if you have individuals that have had ridiculous debts where you have to pay $100,000 debt, you're less willing to go in debt again because it's risk aversion, right? So those are things, and to learn more about it, time constraints, trust issues, and just maintaining information.
Yeah, I think there's probably
open your mind to different types of investments.
There's probably some listeners out there who are wishing they only had 100,000 in educational debt. That number goes way up higher than that. So
double or triple, and that is correct. And that takes a while and takes discipline, and so those are things that prevent people from investing further.
Paula, if you could go back 15 years ago, not that I want to change your path, but if you could go back and tell somebody then what you know now to help them get to where you would want to be now, what would that be?
It would be like, do not think of your investments as a today thing. Things in your investments in like what's going to happen to you in 10 years and in 20 years and in 30 years. And you start thinking about retirement as well, because even though we're young, when you start thinking about it, sometimes it's too late and you don't have anything to fall back into.
Beautiful. Well, Paula, thank you so much for your time. It's amazing.